Chemotherapy was first developed at the beginning of the 20th century, although it was not originally intended as a cancer treatment. Chemotherapy was a form of treatment that was later invented after surgery and radiation. Chemotherapy was added as a way to destroy small tumor growths that had spread beyond the reach of the surgeon and radiotherapist. Following the creation of chemotherapy, the use of multiple chemotherapy drugs over single agents came about, which was considered to be a huge advantage as well as a huge step in the right direction. The whole idea of chemotherapy was brought about by a man by the name of Paul Ehrlich, who is believed by many to be the father of chemotherapy. This is Paul Ehrlich right here. As a teenager, Ehrlich was already fascinated by the process of staining microscopic tissue sections his cousin prepared. Ehrlich was originally trained as a physician. He found more fascination in laboratory work and dye staining of tissue samples and blood leukocytes. Paul Ehrlich's career can essentially be divided into 3 phases, all of which were influenced by his deep understanding of the principles of chemistry and the related idea of specific molecular interactions in various biological systems. Ehrlich was a member of the group of young scientists between 1850 and 1915 who made substantial progress within chemistry, biology, physics, and medicine. Early on in Ehrlich's career, he was recognized as a talented chemist and later found that he was completely obsessed by laboratory research. According to the article by Animal Research, Ehrlich's first steps towards chemotherapy began in 1891 when he noted a report that methylene blue was an effective stain for the parasite of malaria. This caused him to test its action as a treatment to eliminate the infection. The results seemed to show promise, but there were, of course, bumps along the way with drawbacks in transmitting and maintaining parasitic organisms in suitable animals. With that being said, it is also believed that Ehrlich was influenced to start taking a deeper look into chemotherapy because he was smoking 20 strong cigars daily, which drew questions not only from himself, but from his former chemists as well. In a pioneering effort to detect drugs capable of specifically killing certain microbes, Ehrlich synthesized a series of specific antimicrobial drugs, the most famous example being arsphenamide, the first synthetic agent against syphilis. As I mentioned before, chemotherapy was not originally invented to cure cancer, but to cure syphilis itself. The whole series of trials had taken over 4 years of patient painstaking and devoted scientific investigation by the best brains in Germany. The world would now have a cure for syphilis. This newly found cure for syphilis would now give Ehrlich a broader knowledge spectrum to work off of in hopes of expanding chemotherapy beyond the lab, as well as expand its horizon of what chemotherapy can and will eventually cure. Yes, it may be somewhat satisfying to know that there is just one more step within the process to hopefully finding an ultimate cure for cancer, but the research isn't done yet. According to the Centers for Disease Control and Protection, each year, approximately 650,000 cancer patients receive chemotherapy, and the numbers only seem to be on the constant rise. Without chemotherapy, the number of cancer survivors would be slim to none, so it certainly shows that we are headed in the right direction, but we still have a long way to go. We can thank Paul Ehrlich for these huge steps towards finding a cure for cancer because chemotherapy had a major impact on cancer patients as well as healthcare professionals, and it still does today.